Good evening. Thanks for joining us. We begin with breaking news. CTV News has learned that masks will be returning to healthcare settings, including hospitals and care homes. But there is some ambiguity over exactly who will be expected to wear them and where. Our Penny Daflos broke this story today. Penny, you've obtained an internal memo that went out to some healthcare workers outlining ramped up infection control measures.
Yeah, and masking is one of those measures, Mijang. They're calling it continuous for healthcare workers, visitors, and contractors. For patients or care home residents, it'll be optional unless a health worker asks them to. But the word mandatory is not in the plan, so a short time ago, I asked the health minister to clarify. Is it going to be that masks are strongly recommended or that they're going to be required starting October 3rd?
Well, two things. One, we're having a press conference tomorrow where Dr. Henry, our provincial health officer, and myself will be addressing that and other questions. So you'll find out those answers tomorrow. But it's not a secret. We've been talking about this for about a month.
According to the leaked memo, continuous masking will be in all healthcare settings, including hospitals and family doctors' offices, as well as care homes and assisted living. Many frontline healthcare workers are already speaking up in support of the move, with some suggesting it should be a clear order.
Well, they should have done it earlier. And in addition to that, it should be, let's go back to mandatory masking in healthcare setting. We can't afford to lose any healthcare provider. We need to protect the health of British Columbians that are coming in to the emergency department for all sorts of reasons.
So, Penny, we know that masking, it can be a polarizing issue. We've seen some people get really agitated, even to the point of assaulting people. So is there a safety plan for healthcare workers?
Well, that is a detail that we hope to learn more about tomorrow. But what I do know is that nearly a year ago, Dix announced 334 protection officers would be hired to handle aggression and violence in hospitals. But only 14 are on the job right now. With hundreds still requiring training and orientation, they won't be on the job in time for next week's rollout of continuous masking, Mijang.
So I'm sure you'll be asking Adrian Dix about this tomorrow. All right, thanks, Penny.